Let us now examine the calvaria, the internal and the external surface. On the external surface, there are articulations of 4 bones, which are the following: the frontal bone, 2 parietal bones, and the occipital bone. They form sutures by joining together. The first suture is the coronal suture. Watch more videos in the Easy Anatomy app. With Easy Anatomy, you can learn much easier and faster. We provide a comprehensive video library, related PDF notes, and atlas sections with engaging flashcards. Download Easy Anatomy from the link in the description. The second is the junction of the 2 parietal bones, the sagittal suture. And the junction of the occipital bone with the parietal bones is called the lambdoid suture. There are also 2 pairs of tubers. These are the frontal tuber and the parietal tuber. The parietal bones have parietal foramina. Now we come to the internal surface. The groove for the superior sagittal sinus passes here. It is formed by combining all the grooves for the superior sagittal sinus on the frontal bone, on the parietal bones, and on the occipital bone. Furthermore, we can distinguish granular foveolae on the internal surface of the parietal bones. This is the point of attachment of the cranial arachnoid mater. Also, on all surfaces of the bones we can see impressions of cerebral gyri. These are the traces of attachment of the cerebral gyri. The arterial and venous grooves are traces of vessel attachment.